Hi, my name is Dr Craig Mallorie. I'm here today to talk about the costs of dental implant procedures. You may see a real scale of costs advertised on the internet and in brochures with regards to dental implants. So why the difference in costs? Well, ultimately there are multiple stages to the dental implant procedure. Firstly, you have the dental implant root, which is placed into the bone, and that is done during a minor surgical procedure. And then you have the restoration of that root with a crown at the end of the chain. Now, initially, there are multiple implant systems out there, basically different manufacturers of the titanium root. There are over 2,000 worldwide companies that provide dental implants. Only a handful of those provide dental implants that have been around for over 40 years. So these systems carry with it huge amounts of data and research to show that the way the implants are manufactured carry with it hugely high success rates. Some of the lesser known dental implant companies do not have this data. They may have a 5-year data or 2-year data. And for my patients, that's not what I would hope to, that's not what I want to put in my mouth. So these costs, these implant companies that have the higher costs, the actual implant that's going to the jaw is much more expensive than the cheaper alternatives. Also, the level of which the surgery is performed. We perform all our surgery under hospital grade sterile surgical draping and setup, which mean that over 10 years I've never had an infection of a dental implant procedure. And I think it's a testament to the quality of the setup and the surgical environment in which we place our dental implants to create a really sterile, clean environment in which to operate. Then when it comes to the restoration of that dental implant, the crown and the manufacturing of that crown, we use some of the leading dental technicians using high quality materials and ceramics to create a result that is long lasting. The cheaper alternatives we see frequently coming through our door, that patients have had the cheaper options either abroad or within the UK, and they're seeing that the things are breaking, implants are failing, and then we have to start again. And ultimately, with those cases, the patient ends up spending a lot more money than had they had it done properly to begin with. Also, part of that cost, you're paying for the skill of and training of the implant surgeon. Who's placing that dental implant? Is it a dental implant surgeon who's done a weekend course and is having a go? Or is it someone who's done years and years of training? I myself have done implant diplomas in dental implants. I've done master clinician training programs at UCLA, and I frequently lecture on the topic of dental implants. I supervise in the oral surgery department at King's College Hospital. Dental implants is a big part of our practice. So therefore, I can say to my patients that, over the past 10 years, I've had success rates in the upper jaw in excess of 98%, success rates in the lower jaw of 99% because of discrepancy in the quality of the bone. Most failures I see are in people who are heavy smokers or have poorly controlled diabetes. But hopefully that gives you an idea as to what the difference is between someone advertising a £600 dental implant and someone advertising a £2,000 implant. Your money is going correctly. It's not the same. You're not getting the same thing. And please don't compare apples with apples. Because there is a danger there, and ask the right questions. What is the level of training of the surgeon? What materials are they using? Where's that crown made? Is it sent to China and made over there? Ask these questions, and please ask plenty of questions before you commit to one of these cheaper implant procedures that are out there. I hope this has been helpful. Thank you very much for listening.